What are health authorities doing to help autistic people? Joining us on the Newsday set is the Gauteng Health MEC, Dr. Gwen. Good afternoon to you. First of all, just picking up on the point that our reporter Michael Murillo was making, and I think this is a very important one, is that often society confuses autism and intelligence. Yeah. And that figure that he's just pointed out, about 44% either with an average or an above average IQ, is very important. And I think because of that, it's where the stigma comes in sometimes.
Yes, I think that's a very important issue to note and to highlight. When we refer to autism, we actually refer to autism spectrum disorders. And just like TB affects those who are intellectually disabled or incapacitated and they're very intelligent with high IQs, autism can affect anyone, any child for that matter. So, but in some autistic children, you do get intellectual disability. So that should not also be ruled out. But you also do have children that processes things differently and they need to be accommodated by the system.
Given that there are so many competing medical priorities within the health system in this country, as far as the state is concerned, to what extent do you think that this is a forgotten or a hidden condition?
Jeremy, we deal with autism amongst the spectrum of diseases that are in mental well-being and mental health. As the World Health Organization says, health is not only the absence of physical illness, but it's also mental well-being and so forth. So we also have specialists, especially in our central hospitals, who are referrals. We work with the Department of Education to screen grade Rs as they come to school, those who have hearing difficulties, learning difficulties, behavioral difficulties. We also screen amongst others for autism. So that is also one of the issues. And we are happy in Gauteng that the Department of Education has also introduced specialized schools for those that can't be mainstreamed. But the policy is that there must be a mainstreaming of autism curriculum, in the curriculum, to be able to integrate the children in the schooling environment so that they also don't feel excluded but included. The problem, though, is that it always does come down to money, is that yes, if you're in the private healthcare space, it is going to be easier to diagnose early, which is absolutely critical, and seek the specialized help. Often within the state system, poorer parents are surely going to be disadvantaged, and that could have a long-term impact on the child's development down the line. What we must think about is what the United Nations has already agreed to, and also us in South Africa we've agreed to in the National Development Plan, is that we must move towards a situation where health, quality health, is not limited by your social standing. Although some say it's utopia, but that's what's happening in the UK. You know, even one of our own private hospitals is coming back because the demand for private sector is reducing. The demand is more on the public sector. So our approach is that the public health system must be contributed to from the economic health rent, which is about 8%, which is reasonable, in an equitable manner. But what we do, we have antenatal services where we also look at the screening for mothers who have the history in the family and all that. We anticipate that. We also have well baby clinics from 3 days throughout during the immunization programs. We also screen for behavior. We work with the schooling environment to ensure that the children are not missed just because they use public systems. And in our public health system in Gauteng, we have many people who are working, and all classes actually use the public health system. It's not only the poor in Gauteng. All very well and good then with the efforts that you're making in terms of screening, but it's also the difficulty arises in post-diagnostic care, surely. Yes. Children who are diagnosed with autism along all aspects of the spectrum do need specialized care. They would need specialized medication, for instance. Yes. Often that support down the line surely would be a lot more difficult. I must say we must do more, especially at the diagnosis level, including strengthening awareness by our clinical nurses as well as our doctors, especially general doctors, to be able to be aware when there are behavioral or even sensory problems, to also exclude autism and or refer to specialized clinics.
And often the problem, MEC, is that because the healthcare system is so crowded, that's something that either with clinical nurses or with doctors, it can simply slip through the cracks.
It may, but it's not limited to public sector, even private sector. Anywhere in the world, we are conscientizing the medical fraternity, the health sector, to also focus on autism. And that is why for this year, for instance, the focus for World Autism Day is that we've been focusing a lot on boys being more at risk. And although they are 4 times at risk, but we haven't been focusing on girls who present with behavioral problem to also exclude. So continuously, the medical fraternity, the health system is looking at how to improve early diagnosis and early treatment, because it does make a difference.
And then comes the next phase, is overcoming societal stigma.
Oh yes, indeed. Like with HIV, AIDS and other diseases, we actually recommend that there be social clubs, so that there can be social solidarity. Those mothers or parents that are just exposed to this illness can then be able to understand that there is more knowledge, there is support, but also the mainstreaming to conscientize teachers that they must not be hard and harsh on children with learning, but they must look at excluding such barriers. But indeed, we need to do more to make sure that the society is aware and that help can be available. Although I acknowledge it's not an easy issue to deal with because of the unique needs of children and also adults with autism who had autism.
Dr. Ramokgopa, on a different issue, and I would be remiss if I didn't ask you this, is the Gauteng administration on track at this point to meet that 3-month deadline for the payment to the Life Esidimeni families?
The payment is by government. And we have already had our initial special executive council chaired by the Premier to fully understand the ruling by Judge Moseneke, and also to develop an action plan to comply with all the rulings that he has come up with.
What will comprise that action plan?
The action plan includes making sure that we prepare for the payment to meet the deadlines. The second issue, it is to ensure that those that were not represented at the hearings, should they be able to come through and forward, that they will be assisted. And the third issue is to make sure that the recovery plan that we have been involved in since the Ramokgopa report is, we give progress report on it, and that we work with the families to make sure that the counseling, those who need counseling, there is also a program for counseling.
You're confident that you're ticking the boxes in that respect, but are you confident that that 3-month deadline is going to be met?
We are working within that 3 months deadline. We making sure that we leave no stone unturned, and we're putting also special teams. We've also had a discussion with the National Minister here on, and we will work together because indeed this has been one of the most profound experiences in the health sector since the democratic dispensation, and we would like indeed to find closure in a manner that we take lessons of saying never again.
The 44 patients that you reported last week that were still missing, what's the position there? Have they been found? What efforts are being made in that respect?
When the ADR process began, there were about 66 patients or 64 patients missing. We've been looking through the health system, patients that are readmitted and all that, and those that are with NGOs. And I think after about a month, we managed to track the others. It was at 54. And currently, I'm actually happy to announce that we have been able to identify. We don't refer to them as missing, but that we have not been able to account for, unlocated. So we've been able to locate all patients other than 28. So the last count we were at 28.
So that figure has dropped in a week from 44 now down to 28.
Yes, in the last month since the 44, it had dropped to 28. And we are, as I've committed, we're really working hard to make sure that we account for each and every patient that left Life Esidimeni during this period.
Thank you very much for joining us. The Gauteng Health MEC, Dr. Gwen Ramokgopa, with us here on Newsday.